I started working with this patient in early 2023. She sought out care at Vida because she was struggling with the menopausal changes, fatigue, poor sleep, weight gain, changes in her cardiovascular health, and she was really looking for some holistic, comprehensive care. We started with a large set of labs that really helped us kind of see where is her baseline, where do we need to focus attention, and then from there developed a treatment plan that included a lot of supplements but also some medications. We brought on hormone replacement therapy, and then we also brought on a continuous glucose monitor. This tool was something that she found really helpful in understanding how her blood sugar responded to the food she was eating, which allowed her to kind of dial in nutrition and served her on the weight loss front. She also found that if she was really stressed, blood sugar would spike, and then how she would crash energy-wise after. So allowing her to use that tool to stabilize blood sugar helped her not only from a weight loss energy perspective, but in controlling inflammation, blood pressure, cardiovascular markers, etc. From there, we've gotten to take a deeper dive into her health using the 3x4 genetic test, and this pinpointed certain aspects of her biochemistry and her health that we needed to focus on. So taking further steps for inflammation, oxidative stress, cardiovascular markers, and detox allowed us to pinpoint nutritional recommendations and supplements by understanding her genetically predisposed biochemistry makeup. And then throughout the years, things have come up, maybe a low back strain, a UTI, sinus infection, and I've gotten to see her for those urgent care issues as well, which when patients are experiencing something urgent, they want to go to a doctor they know. They don't want to go to somebody who doesn't know their story and doesn't know all the supplements, medications, and kind of that background. This patient's really, I think, a model functional medicine patient because she's taken all of the recommendations made and run with them. And when I'm working with patients, I really view it as a teamwork approach where I'm there to guide them and to provide them information and knowledge and understanding on their conditions and what that might mean for their future health, but then they're ultimately the ones showing up in their daily life and the ones making the decision to eat right and exercise and sleep. They're also the ones who are in tune with their body and able to come to me and tell me if something's not right, if they haven't been sleeping as well, if now they have headaches, or if there's something going on that we need to then adjust so that they can feel like their healthiest version of themselves. One of the benefits of the concierge model is that we have really capped patient panels. This allows us to have openings and spend more time with our patients. I do still have some spots on my panel if this sounds like a type of care that you'd be interested in receiving and exploring kind of that personalized, individualized approach.